The benefits of a seizure action plan, as discussed by both a health professional and parent.
Today I'm here to talk to you about a very important document that we would like to have included in your child's care if your child has epilepsy. I'm going to take you through the different components of the epilepsy plan and discuss them in depth with you. The Seizure Action Plan is a 2-page document written by the parent and the physician, whether it be the neurologist or your pediatrician. It's basically a plan agreed upon for an intervention should your child need it. It is written by both and signed by both, and by being signed by the parents, it serves as permission or authorization for the child care provider to administer some of the as-needed medications should it happen to be there. The first section of the Seizure Action Plan includes all of the basic contact information for the child. It includes their age, their date of birth, their weight, and how to reach mom or dad or grandma in case of an emergency. It basically also will tell the provider what the seizure type is that the child has. Usually, once a child has seizures, they usually have the same type of seizure recurrently if they're to have more. So if we write on the action plan that Sally may fall to the ground at the beginning of her seizures, more than likely that's what the child care provider will see should she go into one. And that way it just lets the child care provider be a little more comfortable in trying to identify them when they occur. At the bottom of the first page of the Seizure Action Plan will be a list of the child's medications, both the medications they take on a daily basis and their as-needed medications to use in case of an emergency. Below that will be listed any dietary restrictions or diets that they may be on to help with their epilepsy. After that will also be listed any devices they may have implanted as the deep brain stimulator or the vagal nerve stimulator. The second page of the Seizure Action Plan goes over basic seizure first aid, what to do in case the child has a seizure while in somebody else's care. Basically, you want to remove any objects that may harm the child during the seizure. You want to keep the child turned to his or her side, and you want to loosen any restrictive clothing that may cause harm during the seizure. The other thing you want to do is watch the time so you can identify how long the seizure has been going for, because in the medication list it will tell you at what time into the seizure you're to administer some medications. The medication list also states the medication to use, the amount to give, when to give it, and the route to give. Some of them will be oral, some of them will be rectal. It also will tell you exactly what time or what to do after the seizure emergency medication has been administered. Should it not stop the seizure right away, when you should call 911. At the bottom of this page is a section called Authorizations. By signing this, the parents are authorizing the school nurse or the caretaker to administer the as-needed or emergency medicine and to communicate with the medical team or the neurologist. It's a really easy, just a signature means that I can talk to the school nurse or Grammy, whoever's taking care of the child in case of an emergency. A copy of this plan, as I think I mentioned before, will be sent to the child's primary care. It can also be sent to the hospital that you affiliate with, and it will also become a part of their medical record in Dartmouth-Hitchcock Medical Center. We routinely will get a call from the pediatrician in the emergency room asking, what do I do now? And this Seizure Action Plan clearly outlines what they should do. Sylvia Pelletier has been working for the Project Access for over 2 years as the project coordinator. She is also a parent of a child with a history of seizures. She will explain the value of having a seizure action plan from a parent's point of view.
A seizure action plan really provides consistent, accurate information for other providers who may be caring for my child, so they know what to do in the event of a seizure. Since each child is unique, it really provides what should happen for that child. For instance, my son didn't require a diastat. It would never have been appropriate to call 911 for him, but we were supposed to track how many seizures he was having at that time, how long they were lasting, and then provide an oral medication after so many. It was very complicated, and it caused a lot of anxiety for a lot of providers, but having a plan really outlined that. and eliminated a lot of fear and anxiety for providers and for parents alike. I would give a copy of my child's seizure action plan to anyone who's providing care for my child in my absence. Often I think some of the reluctance to care for our children is because they're not sure what to do when a child who's in their care has a seizure. Having a clearly outlined plan that says, what does this child's seizure look like and what am I supposed to do if it happens, eliminates a lot of that fear and anxiety. For the providers, for me as a parent, I feel a lot more secure leaving my child in someone's care if I know they know what to do if he has a seizure.
Thank you for taking the time to listen to us today. I hope that you will contact your pediatric neurologist and get a seizure action plan for your child to make sure that they're taken care of in all situations.